Well, joining us now is Dr. Frank Esper. He's a pediatric infectious disease specialist at Cleveland Clinic Children's Hospital. And Dr. Esper, President Trump said he'd like to see the country back by Easter. You want to give a medical opinion on that timeline?
You know, I think we still don't know exactly how this is all going to play out. This virus has been throwing curveballs at us from the beginning. But it's one thing to say, though, is that it's not just one big epidemic here in the United States. It's a bunch of little mini epidemics. What's going on in New York is very different from what's going on in Kansas, and what's going on in Kansas is very different from what's going on in Florida. And so each state, and even each city within each state is all going to have little different timelines for which we can, have to watch the virus very closely and try to do our best to stem that tide. But I don't know what the future holds, and we can only hope that things are going to get better very quickly.
What about these drugs? It used to be if you had malaria, you took quinine. That was the answer for malaria. Now they have a quinine distributed. Is that going to be effective, you think?
The answer is that when we're in the middle of an outbreak, we don't build new drugs from the ground up to fight this new infection. That takes years, if not decades sometimes. What we do is we dust off every medicine that we have on our shelves, things that were for a virus and things that weren't for a virus, and we try them all. And what we're finding is there's a bunch of different medications, one of which being the chloroquine that a lot of people have been talking about, that seems to have some effect on this virus and has been used in the past. Now, because we had SARS about 15 years ago and we had MERS about 7 years ago, we also had drugs for them. And so we took those drugs off the shelf and said, hey, can we use these against this coronavirus? There's several drugs that are very promising. Chloroquine is one that we've been using for decades, so we know it's safe. But we just don't know exactly how effective it is or what dose we need to use it at. That information is going to be coming out. Other medicines like remdesivir, which is the medicine that was directly created for coronaviruses. We're going to have early data on that in a couple of weeks, and then we're going to really find out whether or not we have something that we can use to help people who are really, really sick.
Well, if a drug is designed for a particular use and it's used for another use, is a doctor permitted to do that if he wants to?
Yeah, welcome to pediatrics. That's exactly what we do here, because nobody designs drugs for children. And a lot of times they're designed for adults, and then we in pediatrics have to carefully, cautiously, and methodically use medicines for children who have very similar problems to make sure that we have the right doses, to make sure that they are able to tolerate those types of medications. We do it very carefully. But yes, just because if a drug is allowed by the FDA for one disease, it can be used for another disease if you have a little bit of information suggesting that it would work. It can't be approved for that second disease until it's gone through all the FDA regulations, which is what they're trying to streamline right now. The FDA says, we need to know how well it works against this coronavirus, but also what's the dose? Are there new side effects at that different dose? These things still have to be learned.
Well, we understand that the children were being pretty much spared the effects of this coronavirus. Is that true or not?
Well, I wouldn't use the term spared. Children can get sick, and we have seen children get very, very sick. Thankfully, though, they are not getting sick nearly as often as adults are. But that doesn't mean that they're off the hook. They can still get very, very ill, and they can still get very sick, but generally they tolerate this virus much, much better than older adults. And we just saw a great report that came out from the Centers for Disease Control that showed that young adults between 20 and 44 were also still getting very, very sick, but they were able to recover from that sickness much better than adults 65 and older. In the end, everybody needs to take care. Whether you're 2 years old or 102 years old, you need to make sure that you care for yourself and that you are trying to do your best in order to prevent yourself from getting infected at all.
One last thing, how the hospital, if there is a surge in infection with this coronavirus, are the hospitals able to take care of it?
you know, every hospital system is different. I can certainly tell you that here at Cleveland Clinic, we have been focusing on, you know, this potential surge of patients ever since we heard about this virus. Back in early January, we have been preparing and we have been figuring out new solutions to a possible surge. If we need to, in 72 hours, we can open up 1,000 new beds that weren't there before. We have mitigated, you know, types of procedures and surgeries that aren't deemed absolutely necessary so that we can free up ventilators, that we can free up bed space, we can free up all the masks. We have been planning for masks and everything. So there's a lot of preparation that goes on right now, and it continues to go on.
Well, congratulations, Doctor. Thank you so much for being with us on the 700 Club. Thank you.
Sir, it's been good. Thank you very much.
Thank you. Dr. Esper from the Cleveland Clinic, a marvelous extra. I mean, they're doing all kinds of tests.